Hello everyone. Today, we're delving into the world of a medication called Diclofenac, commonly known by its brand names Voltaren, Cataflam, and Zipsor. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Diclofenac, known both by its generic name and its various brand names such as Voltaren, Cataflam, and Zipsor, is a nonsteroidal anti-inflammatory drug, NSAID. It's available in multiple forms including oral tablets, capsules, and as a topical gel or patch. Diclofenac works by reducing substances in the body that cause pain and inflammation, making it effective for managing various conditions such as arthritis, menstrual cramps, and acute pain. Additionally, it's sometimes prescribed for migraine headaches and for the management of pain and inflammation after certain surgeries. Diclofenac can be an effective option for short-term pain relief and is often used as part of a comprehensive pain management plan. It's essential to use Diclofenac exactly as prescribed by your healthcare provider and to be aware of its potential side effects and interactions. Warnings: Diclofenac, like other NSAIDs, comes with important precautions. It's not recommended for use in the later stages of pregnancy, as it may harm the unborn baby or cause complications during delivery. Individuals with a history of allergic reactions to NSAIDs should avoid Diclofenac. Additionally, those with a history of stomach or intestinal bleeding, ulcers, or related conditions should use Diclofenac with caution, as it can increase the risk of stomach bleeding or perforation. Long-term use of Diclofenac can also increase the risk of cardiovascular events such as heart attack or stroke. It's crucial to discuss your medical history and any concerns with your healthcare provider before starting Diclofenac. Before taking this medicine. Before starting Diclofenac, it's important to discuss any pre-existing medical conditions and current medications with your healthcare provider. Inform them of any allergies, especially to NSAIDs, as well as any history of stomach ulcers or bleeding disorders. If you are pregnant, planning to become pregnant, or breastfeeding, consult your healthcare provider before using Diclofenac. Regular monitoring and follow-ups are essential to ensure the safe and effective use of this medication. Side effects: As with any medication, Diclofenac can cause side effects. Common side effects may include stomach upset, heartburn, nausea, and headache. Serious side effects are rare but can include gastrointestinal bleeding, liver or kidney problems, high blood pressure, and allergic reactions. It's important to seek medical attention if you experience severe or persistent side effects while taking Diclofenac. Interactions: Diclofenac may interact with other medications, including blood thinners, certain antidepressants, and some herbal supplements. It's crucial to inform your healthcare provider about all medications, supplements, and herbal products you are taking to avoid potentially harmful interactions. Dosage: The correct dosage of Diclofenac depends on the condition being treated and the form of the medication. It's essential to follow your healthcare provider's instructions carefully and not to exceed the recommended dose. Diclofenac is available in various strengths and formulations, so it's important to use the appropriate form and strength as prescribed. Avoid: While taking Diclofenac, it's advisable to avoid alcohol, as it can increase the risk of stomach bleeding and other side effects. It's also important to avoid prolonged exposure to sunlight or tanning beds, as Diclofenac can make you more sensitive to UV radiation. FAQ: Many individuals wonder about the safety of Diclofenac in children. The use of Diclofenac in children is generally limited and should be supervised by a healthcare provider. It's essential to consult with a healthcare provider for any specific questions or concerns regarding the use of Diclofenac in children. Closing: That concludes our overview of Diclofenac. Remember, this information is intended for educational purposes and should not replace professional medical advice. If you have any questions or concerns about Diclofenac or its use, be sure to consult with your healthcare provider. Thank you for joining us.